record. And I'd like to welcome everyone. This is really a new series, and we're very grateful to have three professors and clinicians that are here with us today, and extremely grateful to Professor Tabon, who spearheaded it. It was his idea. And since I am not that great with the introductions, I will give this over to Professor Tabon to introduce himself, say a little bit about how, your place at the university and what you're working on, and also to introduce our wonderful panelists that are here with us today.
Perfect. So welcome everybody to our first Healthy Aging series. This idea started, I think, in March, and was really something that resonated with me because when I think about healthy aging, it applies to all of us. Even if I'm younger, I still am aging. And knowing what I can do in my own healthcare is important. But I know with our retirees and pre-retirees, sometimes having these discussions with your provider or your healthcare team might be a little more difficult. And we wanted to provide this as a series where we're able to give our retirees and pre-retirees the opportunity to have discussions with us as clinicians in geriatric care. For those of you who don't know who I am, I'm Patrick Tabon. I am an assistant professor of clinical pharmacy at the USC School of Pharmacy. I have been with the USC School of Pharmacy for the last 5 years, and many of our retirees know me as the Medicare Part D person. And over the last 5 years, we've saved about $200,000 worth of excessive prescription drug costs for our retirees. And we continue to do so with a hope that the healthcare system gets fixed somehow, because that is an astronomical number to have to consider all of our retirees paying for their medications. But I'm also joined by part of our healthcare team and what we call our geriatric workforce enhancement project team. I have Ashley Hall, who represents occupational therapy, and she's also an associate professor at the Chan Occupational Therapy School. And then I also have a colleague I work directly with, and that's Teresa Sivers Teixeira, who's a physician's assistant with the Department of Medicine and Geriatrics here at the USC system. And so this collaboration really with the USC Emeriti Center really focuses on the vision of the Emeriti Center. And that's really making sure we're promoting living healthy and purposeful lives even after you retire from the schools that you are teaching at, or as a staff after you retire for your years of service. And it really is, if you think about healthy aging, multi-generational, multidisciplinary, and multicultural. So it really fits well with the vision of the Emeriti Center. And I'm really excited to be able to be a part of the series today, but also help coordinate and curate some of the future presentations that we'll have as part of the Healthy Aging series. And so today's talking about you as being part of the healthcare team. And this is a really important concept because in practice now, the emphasis is on having interdisciplinary teams for older adults and having multiple team members be able to share what's best for one person. And that puts you at the center, right? The center of the healthcare team. But sometimes that feels overwhelming. I know as a caregiver for my grandmother, being part of the center of the healthcare team, sometimes there's a lot of conversations that we don't have because it's intimidating to have all of these providers and healthcare professionals ask us questions that we don't know answers to. And it's also very traditional for somebody like me to not speak up against a medical provider or even a pharmacist when I was younger, to say, that's not what she's taking this for. And so we wanted to open up this conversation of how this empowerment can happen from the patient-centered care approach, and really emphasizing some of the expertise on our panel, especially knowing what is coming in the horizon with age-friendly health systems. I think that's a real big push that the three of us speaking today really want to see, is age-friendly health systems developed across the country. And so I'm going to actually hand off this first part to Teresa, who's going to actually start with the idea of what matters. And really, this is the basis of having a good, meaningful conversation with a healthcare provider. Teresa?
Can you hear me okay?
Yep.
Great. Hello, everyone. As Patrick said, I'm a PA. I practice geriatric primary care at the Keck Medicine Pasadena Clinic, and I do research and education all around older adult medicine. So I'm really honored to be here and proud to be part of the SQEP team. So let me tell you really briefly what the game plan is for my talk. I'm going to talk a little bit about aging, and then I'm going to transition to this model of care that Patrick referenced, known as age-friendly healthcare. And then I'm going to review some ways that you can equip yourself for your key role on your healthcare team. Next slide. So first of all, a shameless plug for primary care. If you don't have one, get one. This is really one of the cores of aging is, even though we have all our specialists, working with somebody that has known us through all the changes in our lives, and knows the team players can really, really make a difference as you age. Next slide. So aging, we're all doing it. The good news, Gene Cohen, who's the founder of geriatric psychiatry, did a lot of work, and he figured out what we probably already intuitively knew. Our brains are continually resculpting based on our experience and learning. And so what happens is, as we age, there's a developmental intelligence based on what we've learned and what we've experienced. He calls this developmental intelligence. I think we more commonly call it wisdom. And this is one of the greatest benefits of the aging brain and mind. Next slide. So here's the not so great news. As we age, we tend to accumulate more health issues and more functional issues. And that tends to lead to more medical intervention, more specialists, more medication. As Patrick has already probably talked about before, 30% of Medicare beneficiaries saw 5 specialists last year, and about 20% of Medicare beneficiaries take 10 or more prescribed medicines each day. So what's the challenge with that? Well, the challenge is there are a lot of, many of us, not all of us, but many of us have really pretty complex health resumes, multiple chronic conditions, often divided up into body parts or organs that we have specialists for. And that comes with several providers, and the care might be burdensome and might not always address what matters most to you. So sometimes this care, extraordinary as it is, can sometimes miss the forest for the trees by looking at everything apart. And so what this points to is definitely a need for a different approach, especially for older adults with complex health issues. So enter, next, the age-friendly healthcare system, or more commonly known as the 4 M's. So this model, it's an emerging model that's really gaining ground across the country and even internationally. It's really grounded in the principles of geriatric care, which just tends to look at the whole person and centers the care on principles of optimizing function to improve quality of life. So I'm just going to orient you to this real quickly, but what matters, the first M, matters, it really means acknowledging that each of you may vary about what matters to you most, and knowing what matters to you really should impact our approach to your medical care. Medication, Patrick's specialty, is about making sure that the medication that's prescribed doesn't interfere with what matters to you or negatively impact your thinking or your mobility. Mentation really includes preventing, identifying, treating, and managing depression, cognitive issues, and delirium. And mobility includes supporting you to be able to move so you can do the things you want to do every day. Next slide. So what is she talking about? And what do I have to do? So I really believe in this approach to medical care. And just like so many things, we come up with a theory and approach on how to do things, and we put the patient at the center, and we never give the patient the map. And, you know, I often have people that walk through the door with maybe 7 to 10 serious medical issues, maybe 18 different symptoms, and a legal pad full of questions. And I always ask, so what are your goals for this visit? And often people, you know, show me their big tablet. And we often can't get through those, and it's frustrating. It's frustrating for the patient, and it's frustrating for me. And so I've tried to refine that to ask what matters most to you in terms of addressing a health goal that you have that's going to improve your quality of life. And the truth is, it really stumps people. They're really stumped, not because people don't know what matters to them, but they often don't know how to frame it in a way that's useful in their primary care or in their specialty care. This is definitely not all primary care. Next slide. So again, here's the model. We put you at the top. We didn't tell you that you're at the top, and really we can't do anything in this model. This model doesn't work without helping you and supporting you to identify healthcare goals. So I want to introduce you to a way to think about it and some tools to use so you can facilitate healthcare that supports your way of living, your preferred way of living. So, so how do you identify what matters most to you? Well, yeah, I know my family matters. I know my job matters. I know, you know, it matters to me to keep learning, but that doesn't really help my healthcare provider to know. So, while you can do this on your own, most people, these are the general areas, the categories that they tend to look at it to help build their overall values in life. Most people need some structure to help them through this. And so the material on the next several slides is from my from healthpriority.org, and this myhealthpriorities.org. There are links at the end. You can go on and do this yourself and create an ongoing profile so that you can track things over time and have something actually tangible to take to your medical appointments. So when you're trying to identify what matters to you, sometimes it helps to first think about things like what gives your life meaning, purpose, joy. What would you be doing? What do you do on a good day? What matters to you in your daily life? And then sometimes it's helpful to, we can go to the next slide. These are the categories. And I'm going to let you look at some of this on your own. I think if we did a brainstorming, many of us would come up with things that are in these categories, but you may have a completely independent category. This is really yours. But what can sometimes help with narrowing things down is looking at an inventory, sort of making an inventory. Next slide, please. Here's an example of something that they have on the website I shared with you. They're common things, and it just really asks you to pick out 4 things that you really matter most to you. Not maybe your whole life, but right now, what is it that matters most to you? You do that, and then you narrow it down to 1. Next slide. So knowing what matters, knowing your values, using your values to establish what matters to you can really help you identify a goal. So if you saw on the last slide, I had the value, some of the values that I had used for an example is enjoying life and hobbies. Often there are things that get lost as people have more things that limit their function in everyday life. And what matters most to me is being able to walk in and outside of my house. That's what I identified as what matters most. And from that, I was able to identify a pretty specific thing that would really improve the quality of my life, which is being able to work in my garden 2 to 3 times a week. So that's the health goal that's come out of that exercise for me. Next slide. So once you have your health goal, and you may have many health goals, but it's really about narrowing. Are there any symptoms, or it's about then looking at what symptoms or health problems you have that are interfering with your goal. My goal is really working in my garden 2 to 3 times a week. What is it that makes me not be able to do that thing that's very important to my quality of life? Well, it's dizziness, it's feeling unsteady, having trouble balancing, and I'm afraid of falling. Those are real things. And that gives you something to go into your medical appointments and talk about with your provider. You can talk about that with your cardiologist, with your urologist, with your primary care provider. And what it does by knowing what matters and having some healthcare goals, it really changes, the medical interaction. You're still looking at the data, you're still looking at all the diagnostics and all the labs and all the medications, but the clinical interaction is really focused on you, not the data. And it's looking at things through the lens of, you can go to the next slide. It's really looking at you through the lens or your experience through function and quality of life. And then that gives you the opportunity to partner with your provider, specialist primary care, to lay out some options for changes. Sometimes the changes are going to be in the medical intervention, and sometimes the changes are going to live with you. And usually it's a combination of both. So, and that means exploring different approaches and considering different trade-offs. So for example, maybe one way for me to gain greater stability and have less dizziness would be looser blood pressure control. Might be cutting down on some of my blood pressure medications or glucose medications. It might, and that, what's the trade-off for that? That looser control might put me at a slightly elevated risk of cardiovascular disease. And so you have to balance those things. Another thing is using medical equipment. Sometimes people don't want to use medical equipment and they're very against it. And so we talk, that's a lifestyle change. Maybe it's getting somebody to join you for gardening. People really want to maintain independence, but it also sometimes means partnering with somebody. So these are all options. Nothing, this is no antidote for all of it, but, or maybe maybe somebody absolutely wants to do it alone. They're willing to take that risk of falls, and they'll wear a med alert. So if they fall, they can call somebody. So these are examples of a really focused in approach that will allow you to leave, or any patient to leave with a plan and clear goals that are measurable. And you can see, is this help, or is this intervention in my life, or am I doing things that really get me closer to things that are making my life better? Along with looking at things like this, it really tends to increase interprofessional team-based care, which we're all about. And here are some of the people that are often called in or become part of our team, core members of our team, to get us closer to these goals. And then if there are clear goals, if you're sharing your same goal with me, the primary care, with your cardiologist, your ortho consult, then we're all coordinated and we're looking for that in each other's notes and in our communications with each other. And so just to review a little bit, what we're talking about is your role in age-friendly care, and age-friendly care that prioritizes function based on what matters to you. And what does all of this really do? It's really about improving the quality of life to really facilitate optimal aging. Next slide. And this is how I would define, and many people define, optimal aging. Really means the capacity to function across many domains to your satisfaction with all your medical conditions. And this is this is a close friend of mine. This is one of my best friends who just before her 98th birthday, one of her healthcare goals was to feel well enough to be able to ride in a NASCAR ride at over 150. She asked for 200 miles an hour. They got up to 180. That's what she wanted. And we did some things to make that happen. So next slide. The take home message is think about what matters to you, develop related health goals that are specific and measurable. And identify the problems that interfere with it. During your appointment, talk about it, and actively participate in developing a plan that measures success based on the achievement of your goals and your preferences. And often that means scheduling repeated follow-ups and considerations for new goals. Thanks very much. I'm going to pass it on to Ashley Hall. This at the end, I hope that you all get it. These are some links to some of the things that I presented on and some other things that I thought might be really useful to you. Thank you so much.
Okay, well, thank you for that, Teresa. That was a wonderful introduction. So hi, everyone. I'm Ashley Hall. I am an occupational therapist. I think I have seen many of you this summer and through the years as a part of the Emeriti series with our students in occupational therapy. So I am an associate professor, but I'm also a clinician. So I do both practice and teach. So on the clinical side of things, I'm a certified aging in place specialist, and I work a lot with adults and older adults. It's been an area of passion for me as I've been working these past 10 years as faculty at USC. So let's go ahead and take a look at some of these tips building off of what Teresa laid as a foundation. So let's start off with how to have what we're calling a good conversation, right? A productive conversation that feels like it's efficient and meeting all of the things that hopefully you're hoping to get to with your providers. So starting off with, as Teresa mentioned, first, before you even go to your appointment, identify your values and what matters. Teresa gave some great resources on how to engage in that reflective process if you haven't already, or maybe you need to revisit, right? These things can change with time. And with different circumstances. So it's important to go back and revisit these things. The picture on the right-hand side of this slide is from a value card sort activity that we sometimes use with clients in occupational therapy. So this is, just a few of, I wouldn't say there's like 100 different values. And so we engage people in an activity to help them narrow down and identify the values that are most important to them. And then use that to discuss and connect back to what are the different things that you're doing with your life, and do they reflect and connect back with your values? Hopefully they do, ideally they should, but if they don't, then that's an important discrepancy for us to note and have a conversation around and talk about why that is and what can we do a little bit differently so that you're living your values and what matters most to you. Next, as Teresa mentioned, before you go to your appointment, definitely encourage you to make a list. So expanding on that idea a little bit more, maybe consider having a living document where you can keep all of your concerns as things start to arise, right? You might remember them in the moment, but then we forget about them as we're walking in the door to the provider's office. It can also be helpful to talk about things with family members, loved ones, trusted friends in advance. And also consider input from other healthcare team members, right? Maybe there is something that you talk about with your occupational therapist, your pharmacist, your physical therapist, and they say that would be a great thing for you to go and talk to your primary care provider about, right? Your PCP. So make sure to jot those things down and incorporate them as you are heading into these various different appointments. And then, of course, like any good tool or aid, it's only going to serve you well if you actually remember to use it, right? So make sure to take it with you to that appointment. Don't forget, leave it at home, anything like that. A helpful strategy for some folks that I worked with is, if you really like writing things down, that's great, but then take a picture on your smartphone, right? So that if you lose that piece of paper, it's a picture in your smartphone, so you've got it as a backup just in case you need it. And then building off of what Teresa had started talking about, it's important, I think, to prioritize your list, right? You might have a lot of different concerns to talk to your provider about, and we want to hear and work with you on all of those things. However, understanding the limitations of a single appointment, we may not be able to get to everything that first time, and we maybe shouldn't get to everything that first time, right? It could be very overwhelming, stressful. There might be reasons that we don't want to adjust too many things too quickly. We want to be cautious about that and take a more tapered approach to that, right? So I think understanding that ideally your relationship with your provider should be a longitudinal one in primary care, right? This is hopefully somebody that you're working with for the long term that is really helping to coordinate all of your care. So it may require, and I think feel comfortable asking for multiple visits, right? To address the extent of your concerns and talk about how to appropriately schedule those and in what sort of frequency and duration. Some other tips, so actually during the visit, make sure to take notes is a great strategy. Feel comfortable to do that either on a piece of paper or bring a computer on your phone. There's a wide variety of methods to do that, to take notes in your appointment. I think just maybe discuss with your provider if you have any questions about that. Bring a friend, a care partner, or a loved one is a great way to do that. I know I can share from my own experience. My mom always accompanies my grandma to all of her medical appointments, and my mom is the one who's responsible for taking all the notes. So my grandma can engage in the conversation and really express her wants and wishes without feeling like she's weighed down or kind of got this cumbersome task of trying to jot down all of her notes while trying to maintain a conversation simultaneously. So that's also a really great strategy. And then don't be afraid to negotiate the agenda with your provider, right? Start with your priorities. Your provider may have certain things that they want to get through, right? They may want to go over labs or your medications and those types of things, but maybe those things are less important with you and you want to spend more time on other topics. So at the beginning of your time with your provider, lay out maybe what are 1 or 2 key priorities that you really want to make sure that you get to accomplish today with that provider. See what they maybe have in mind that they really need to get to, and then work together and collaborate for your time together from there. And then last but not least, don't be afraid to ask questions. Don't be afraid to ask, are there any alternatives to the things that you're recommending? Are there other options? These are my values. I'm really hesitant about this, or this is something that seems really scary to me that you're recommending. And so it's causing me to pause. As providers, we always want to hear from people if there are things that are making you feel very cautious, uncomfortable, or if you would like to discuss it further, we are more than happy to do so with you. Okay, so what to talk about and how what to think about heading into those conversations. So some key things, I think very straightforward, right? Be thinking about your health and be thinking about all of the different aspects of your health, right? Physical, mental, cognitive, spiritual, right? All of the different components of wellness. Think about how you're doing in all of those areas, and do you have concerns, right, in your level of wellness in those areas. Consider different medications and treatments that you're receiving, including any therapies that you are currently on, and if you have any concerns related to those. And then also life changes and transitions. Sometimes this is something that people don't always bring up with their providers, but we really want to know about, right? As your team, we want to know if there's anything that is changing in your life, right? Even if it's something that to your mind doesn't seem necessarily directly related to your medical care or to your therapy or anything like that. But we want to know those things because there might be certain things that we need to take into account that maybe aren't on your radar, right? Whether that be, oh, I'm going to be retiring in a couple of months, or, oh, I'm, going to be moving into a new home, or I have a family member moving in with me, right? Those are things that maybe seem peripheral to your medical care, but really for us, we want to know all of those things and any changes that could be impacting your health and wellness and your overall life satisfaction, so that we can collaborate with you, that we can best support you with those as we're able. And then lastly, we just wanted to touch base on a couple of tough but important topics, right? These might be things that seem like they would be challenging. And from some patients that I've had in the past, I would say these are common areas that patients have come to me and said, gosh, I really just don't know how to talk to my PCP about this, right? Or I don't even know how to start that conversation, or can I even talk to them about this, right? And so working with them on some strategies around communication and self-advocacy. So we wanted to touch on what those are and to really encourage you to bring these up to your various providers as you are comfortable and as you think appropriate. The first being abuse, trauma, and gaslighting. This is such an important topic for any healthcare provider or team member that you are working with to be aware of. It can certainly be a topic that we understand is very sensitive for folks to be able to share and disclose. I think many of us are mandated reporters. So if you are experiencing any sort of abuse, whether that be physical, mental, emotional, we absolutely want to know about that so that we can support you in the process of getting you help and getting you into a better position. Understanding if you have a history of trauma that may be impacting your care. I think this is especially important. We want to know if there are things that you have a history of trauma around so that we can taper our approach to minimize any of those triggers that you might be experiencing and to optimize your engagement in your care. And related to that, a history of gaslighting, right? If you have ever experienced medical gaslighting, for those of you who are unfamiliar with this term, this is when you, if you have ever gone to a provider, in particular, medical gaslighting happens when you go to a medical provider and you bring your concerns to them and they either minimize or disregard your concerns. The common example being pain, right? I come to you, I have pain. Person says, nope, there's no reason for you to have pain. It's all in your head, right? And you are made to believe that something doesn't exist when you are experiencing symptoms. So if you've ever had a history of gaslighting, right, I think that's especially important for any healthcare providers working with you to understand so that we can know about that history, so that we can make sure that we address those concerns and that we clarify with you that we absolutely are on your team. We believe you when you are saying things right, and we want to make sure that we have a strong relationship moving forward. I think another topic that can feel uncomfortable for people to bring up, and sort of with a fear of talking about it can manifest it, is maybe a theme that I hear from my patients for some of these topics, right, is driving retirement. We live in Los Angeles. A lot of people are very big and associate being able to drive with a sense of independence, a sense of purpose, a sense of well-being, right? So the topic of driving retirement can feel very uncomfortable for many people, with the idea being, if I talk about it with my doctor, they're going to take away my driver's license, right? Or if I talk about it with my therapist, they're going to report me. And that's not the case. We really want to make sure that when we are talking about driving, that it's an important activity for you to engage in. And ideally, we want to have some very proactive conversations around what are your wishes and desires for if and when you are ever no longer able to drive for yourself, right? So that if that happens, we know and we can honor those things for you, right? What if you experience some pretty serious cognitive changes, you're no longer able to drive for yourself? What would your preference be in terms of transportation, right? Getting to and from appointments. Do you want a family member to drive you? Would you like to use access? All of those things can be helpful for us to have a proactive conversation around, so we can honor those wishes and to address it head on instead of wondering and questioning afterwards if we're doing the thing that is going to honor what you want. End of life, I think, is another topic that can feel very confusing or difficult for people to navigate. But certainly we want to encourage people, if you have concerns about end of life, transitions into death and dying, Primary care is about working with people from cradle to grave, right? So we want to work with people on all parts of your life, including death and dying. So it's really important to, if you have concerns or questions about that topic, to feel comfortable bringing those to your provider. And if there's ever anything that we as your team can do to minimize any of the barriers that you're experiencing with talking about some of these challenging topics, to let us know so that we can address those with you and make that a little bit easier of a conversation on our end too. A couple others that I think can feel really challenging for folks to bring up some of these concerns. Incontinence is another one, whether that is urinary or fecal incontinence, perhaps both. Sometimes that can feel very private and personal, or maybe a little embarrassing for some of my patients to talk to their other providers about, or even to talk to me about. But I think, I just really want to encourage you on our end. We work with people on all of these topics. There is never anything that you can bring up that we are going to feel like is not okay to bring up in these conversations. We're really here just wanting to make sure that we're able to address your concerns and your wellness to the full extent of whatever that means for you, including if you're having issues around incontinence. So that's, I think, another area to consider. Relatedly, sexuality and intimacy and sexual identity, I think, is another area that sometimes can feel very challenging, or perhaps like a difficult area for people to talk to their healthcare providers about. So again, just want to provide some reassurance to not be afraid to bring those topics up to your team members if you have any concerns, issues, or questions about this area. And then last, but certainly not least, is changes with cognition. Again, I think sometimes for my patients, there is a fear of, if I talk about it, it will manifest it with relation to cognition, right? When we know that we want to make sure to address, your health and wellness, including your brain health, right? And there are certain things that we can do. While we don't have a magic wand, we may not be able to make any concerns that you have go away completely. There have been a lot of advances in more recent years, right? And there are lots of things that we can do to really optimize your well-being, including your cognitive health as well.
And so to end this off, I kind of wanted to build upon this idea of what matters. And a lot of times with what matters, sometimes it's our medications. The amount of medications we're on, what we're taking, and what it's causing us to have as side effects or concerns we have for a variety of different medications. But I wanted to just provide some simple tips and just a little bit more background of what I do. I actually work in what we call transitions of care. So understanding how, not just between providers, but between healthcare systems, our patients in older adult life travel through. And all of these places that you could potentially end up in for care also include medications. And so I find myself kind of spinning the wheel sometimes, trying to figure out how to connect all the pieces. And for me, just being obsessed with medications, understanding how it affects you as a patient, and even as a healthcare system, how it affects you in terms of financial costs. And so some tips from me as a pharmacist was, with medications, sometimes they're not easy to bring up in appointments. Sometimes the names are really hard to remember, or you don't remember what you're taking it for, and there's some embarrassment with that. But we also really want to know, have you had a recent medical provider appointment? Did you recently visit the ER or have any hospitalizations that affected your medication? I think that's one thing that, in my mind, a lot of patients think, oh, it happens naturally. You'll know if I went to the hospital, but we don't. We don't always know what happens. And having that conversation start there is really a good key point. But the biggest thing I'm going to mention is having a medication list. And I think some of you are really great at having a medication list, so you know what medication you're on, what the strength is, how you're supposed to take it, and who's prescribing it. But a lot of times when you're not able to speak for yourself, maybe something happens and you're in the hospital and you're not able to speak for yourself, this is all we have to go off of. And so it's important to have a medication list and to bring it to your appointment as part of your discussion. Have things changed? Are the hospital records different from the doctor's records? And how can the providers or healthcare professionals help you identify what you should be taking? And one thing I also want to know is, even though the medication might stay the same, the doses might change. And dosing does matter in healthcare. Too high of a dose might give you more side effects because we didn't know it changed. So you're getting double the dose than what you should have actually got. And then allergies are another big point I wanted to make. A lot of times You know what you're allergic to, but we don't know what you're allergic to. So bringing that up to every appointment and knowing what your allergies are really help guide your medical care in a more conversational way. This is an area that I think really I struggle in as well, is making sure to just include my over-the-counter vitamins, supplements, and herbs. A lot of what we have over the counter is relatively safe, but if you're taking it with other medications, it's not so safe. And knowing that can really help identify some of these problems that can occur with drug-drug interactions. And then the last thing is just, I really appreciate honesty. It's always hard to say I didn't take my medication, that's why my blood pressure is high today. But at least I know that you weren't taking it, and so we can start from there. How can I help you take it? What is a better way that we can time your medications so you're more adherent to it? And I noticed that a lot of these conversations around medications, a lot of our patients really focus on, I did take it, but we see that they didn't, and there's ways to determine that, but they feel shameful after, or they feel embarrassed to tell their doctor that they didn't take it. And I think honesty is so important about your medications, because it makes us more comfortable with what our decisions are to help you. And so I wanted to spend at least 15 minutes just for question and answer. So that's the end of the presentation, and just want to have the ability for all of the attendees today to just ask us questions about how to have conversations or anything healthcare related, because we have an excellent panel today that presented a lot of different concepts. And I don't know, Jeanette, if you had any other questions that were sent to you prior to the presentation that you want to.
I think that would be great. Could you take off the, let's see, take down your presentation? That would be great, so we can see you all. I don't have any particular questions. However, I do have a few little things that I know. Some people are caregivers on the call, and some people are considering, are listening to this for their own well-being. And I know I'm doing both. I'm doing both as an older adult myself. And I do have a couple of questions about, a couple of times when I was a caregiver, I noticed that there were drug interactions that we didn't know about, and crazy things were happening. And so the recommendation was go off all of your meds. And that's scary to me. I'm wondering if you could address that, or if you've ever had situations, any of you on the call, any of our presenters, about what to think about that, or even do I recommend that to a doctor or a pharmacist?
I can start. I think that's a great question. Drug-drug interactions, one way to avoid them is actually use the same pharmacy, because the pharmacy systems will automatically run drug-drug interactions prior to dispensing any new medications. I see a lot of times where our patients will use different pharmacies, and so in the system, they're not actually interacting with each other, so there's no known interactions when you're filling those medications. So in an avoidance situation, that's one tip. But in terms of what we call deprescribing or taking yourself off medications, it can actually be very dangerous. Our drugs are developed to last in your system for a certain amount of time. And if you remove it out of our system too quickly, your body overcompensates. And I'll give you a very simple example. When we take something for our heart that slows down our heart because our blood pressure is too high, when you take yourself off of it, it actually shoots your blood pressure higher, and it makes your heart rate a lot faster. And so do you know that as a patient about all the interactions? You don't. And sometimes it's very challenging to understand. But in the area I work in, we help a lot of patients slowly come off of their blood pressure medication safely, so they're not having these negative effects. And then we're also monitoring to make sure it is okay to take them off these medications. And that's why having these conversations are so important. I would never say cutting a medication cold turkey is the safest. There's just so many medications out there that you really need to slowly titrate down over time.
Mm-hmm. Mm-hmm. That makes sense. I see that Ian has a question. Differential diagnosis, are there other terms I can use when having a conversation with my PCP? And which, by the way, I didn't know what PCP was until I started thinking, a primary care physician? Yeah.
Yes. So I just wanted to mention just a remark on the previous question too, which is such a good one. And I agree with everything that Patrick said. Often I find that that happens when people come home from the pharmacy and their pharmacy said, there's a problem. I'm not going to give this one to you. There's an interaction. I'm going to get back to your provider. And so the patient will just quit that medicine and then not follow up with the connection with the primary care provider or the prescriber gets lost. So that's one way I see that. The other way I see it is when people go to the hospital and their medications are changed, and there are, for that acute period of time, some medication changes. So somebody stops one of the diabetes medication, but does a sliding scale insulin while you're in the hospital. I come out, so I think the bottom line on all of those are really very quickly talk to your pharmacist and talk to your primary care provider. And almost never, I mean, I can't think of any time that I can think of several times people have done that, particularly post-hospitalization, and they feel scared to take medication again. And so they stop, or they read something, or a relative reads something. It's just really important to communicate. And at Keck, if you can't reach your primary care provider and they're at Keck or any of your Keck providers, you can still call the appointment line and reach an on-call provider in that. Say you get discharged on Saturday and you're not going to be able to talk to your provider till Monday. There's always somebody there, and almost every primary care institution I know, that has primary care has that sort of thing. So that's my 2 cents. And Ian, that's a good question. I'm not sure what you mean. I know the term differential diagnosis, but when would you use that term differential diagnosis? When would you be wanting to? Can you maybe unmute and tell me?
I just used it one time where a doctor was trying to explain to me a condition that I had, but I still didn't understand quite what it meant, and also what other types of things it could have been.
Well, I think that's great. That's a great question. Sometimes providers will use that term. This is the differential diagnosis, meaning you have a stomach ache, you have a upset stomach. It could be simple gastritis. It could be food poisoning. It could be, it goes from the most benign to actually the most dangerous, which sometimes could be cardiac, could be signs of other things. So I think asking the provider if they could explain it again, and you could always say if it was a symptom and they were saying, here's the differential diagnosis, and we want to rule out the worst case scenarios, and that'll help us narrow in on how to help you. You can just say, wait, what are all the different things it could be? Or, just pull us back into the real world and speak in language that you can understand, and don't ever be afraid to say, I didn't understand what you mean. Can you tell me either what else could it be, or, what should I be worried about, or, any of those things, but just make us put it in basic language, not because you're not smart, but just because that's how things need to be done to be effective. I don't know if that answered your.
Yes.
Great.
That makes perfect sense. I have a sister-in-law who's a family physician, and she's talking to me as a family member, and I'm going, I don't understand those terms. What does it really mean? But I do have another question, and I've noticed that more and more now, research is being conducted on different kinds of pharmaceuticals and treatments and that kind of thing, based upon what people have learned about the different cultures. So back in the day, they were only doing the testing or only doing the research on one particular, like white males or whatever. Is there a way to bring into the conversation, well, what does this mean to me from my culture? I'm you know, I look different. I'm from a different part of the world. What does it mean?
Patrick, I can just say very little, and Patrick can speak to this even more, but very little of the research that's done on medication, especially older research, includes older adults. And so those findings that you often see are not, may not apply, or they may be variable with older adults. And so I know there are a lot of things that are being done to address that. Patrick, do you want to comment further?
Yeah, I was just going to make the same comment. A lot of our research, even now, is really difficult in certain age groups of populations, right? We're testing a new drug, but we're not going to choose people who are older than 65 because we're concerned about side effects. And so the drug will get onto the market, but then somebody over 65 will actually get that drug. And then you actually become what we call the post-marketing data for that drug. But then when you're talking about diversity, equity, and inclusion, even those studies don't even have older adults. And now we don't have older adults with diverse cultural backgrounds. We don't know how it's going to genetically affect them. And there are differences in how we respond to drugs based off of your ethnicity. We're starting to learn a lot more about that now. And it's really challenging working in geriatric medicine, knowing that what's out there on the market, you don't have a lot of data for, but you as a clinician want to do what's best for what matters to your patient. So it's always that balancing act that Teresa mentioned earlier. But in terms of getting more involvement with that, I think it's really just having the drug industry really focus on how our drugs affect us differently, because our genes are different. From a genetic standpoint, drugs interact differently in different populations, even between males and females. There's different ways our drugs work. And that's a whole side conversation, but having more studies and more research on that is definitely an area that has to grow.
I would definitely reiterate being honest with your physician and try not to be embarrassed. You know, even for the thing of like, how much do you weigh if you're not coming in and being weighed and that kind of thing. Case in point, for somebody like me, my physician didn't realize, I mean, looked at the blood work, didn't realize my weight or my age or whatever, I'm not sure what, and put me on a medication for the very first time. And I had no idea what it was going to do, what the, you know, side effects or whatever. I ended up calling 911 because my heart started racing. I started getting numbness. My left arm was in pain. My chest, I had chest pains. And all it was that particular prescription was just too strong for me, but it scared me to death. Not, you know, so what, how can we, I don't know, talk to our physicians or whatever so that we are assured that something like that doesn't happen?
I think I would just say, bring it up. I think honestly, that's the first way, is just to have that conversation, you know, with your provider, and to be really open about that, right? You know, that goes back to sort of like trauma and gaslighting and past experiences, and how that, you know, really shapes and forms who we are living in this present moment too. I think those are really important things to express to our different team members, so they're aware of that and can really work to reassure more actively, right, around these different things. Or, you know, okay, I understand, like, this is a very, you know, understandably sensitive and difficult topic for you. Here are all of the different things, so I can walk you through all of the different safeguards that I have in place. And here's our method for communication, right, if something like that does happen, or whatever that plan is, to provide that additional level of reassurance for you moving forward. I don't know, Teresa, as a PCP, if you have other thoughts to share, but that's usually what I encourage a lot of my patients to do.
I really agree with that. I don't know any provider who would ever really shame somebody for being honest about not taking medication. Often what happens, particularly with things like blood pressure and diabetes control, are famous for, you know, somebody having chronically uncontrolled blood pressure, and we just keep adding medications on, and then one day you take them all and you just bottom out, and you may call 911. And so that sort of being as honest, it's your body, it's just, we're here to help, you're in charge, we're here to help. So the best we can help you is with good data on our end, and your body and how you interact with your body is the most important data. And then the other thing I would say is, Jeanette, that is really, that is a scary story. And it is important to know when you've done your care mostly exclusively via telemed, where you can only see people from the shoulders up, it is important to share your vital signs. That's a really big, important thing. And I know I'm not ever comfortable with sharing my weight, but I begrudgingly do it because I know the way medication is going to be prescribed to me many times has to do with my weight. And then, so I know it's hard, but it really makes a difference.
I guess just really quickly, I know we're wrapping up, but I would just say, if you ever do have a provider, and I'm going to get on my soapbox for a minute, if you ever have a provider who makes you feel shamed or embarrassed about being honest in the way you're reacting, that's a red flag. And I would say you need to find somebody else to get on your team. There's too many good people out there to put up with anybody who's going to treat you in that way. So that's my little soapbox, but
That's a great way to end it.
Well, thank you all so much. We really appreciate it. And those that are on the call and those that couldn't make it, we will be sending out a link to the website that will have the recording, as well as all of the resources, the PowerPoint presentation and whatnot. And please make recommendations for other topics that you would like to have in the future. This has really been wonderful, having all three of you experts and clinicians and professors at USC. So we're very grateful for you being here today. Thank you so much. And thank you everyone for joining us.
Thank you.
Thank you all.
thank you.